Hi, everyone. Thanks for joining us today. We're going to get started in a few minutes. I'm Hillary Sapetsky. As you're probably aware, I'm the NJSOPHE program chair, and we're going to get started probably around 2 minutes after the hour. So as you're joining, you're going to note that your line is muted. So please stay on mute for the duration of today's session until we get to Q&As throughout today's meeting. Also, use the chat box. We're going to be, monitoring it throughout today's session. So definitely submit your comments, your questions, and we'll make sure that they're answered. For now, though, use the chat box. Say hi to your fellow public health professionals and health educators. Say where you're joining us from. If you're joining from New Jersey or maybe somewhere else throughout the country, where do you work? Or just feel free to say hi while we're waiting to get the session started. At the end of today's session, you will receive an email with an evaluation form. So please be sure to complete that evaluation form if you're looking for CHES or MCHES credits for today. We also really just want to hear from you, hear what your thoughts are about today's session, and get your ideas for future sessions in 2022. I will post the evaluation form link in the chat at the end of today's session as well for easy access. Just note that the evaluation form is a Google Doc and it will only be available for 3 days. Okay. So we have a jam-packed session for today. This is our agenda for today's session that we see here. We have a full hour and a half planned. As you know, because you signed up for today's session is titled A Passion for Public Health. So we're going to kick off with our keynote speaker today, Dr. Brian Castrucci from the Beaumont Foundation. And then we're going to move into awards and scholarships, which will be presented by our Awards and Scholarships Committee Chair, Krista, and then we'll move into a really exciting lightning round. So you'll get to hear from fellow NJSOPHE members. They're going to talk to us a little bit about what they've been up to 2020 and 2021. And then we'll finish off today's session with the NJSOPHE board meeting. So with that said, I want to kick us off and get started so we don't lose any time. So I'm going to formally introduce our keynote speaker. We have Dr. Brian Castrucci. He is the President and Chief Executive Officer of the Beaumont Foundation. He has built the foundation into a leading voice in health philanthropy and public health practice. He's an award-winning epidemiologist with 10 years of experience working in state and local health departments. Brian brings a unique perspective to the philanthropic sector that allows him to shape and implement visionary and practical initiatives and partnerships and bring together research and practice to improve public health. So with further ado, Brian, I will hand it over to you.
Thank you, Hillary. Good afternoon, everyone. Good morning. So I'm excited to be here. I am an absolute public health zealot. It is all I have ever done in my entire career. And this is also, it's a tough time to be delivering a talk about the passion for public health. We've watched our colleagues bullied. We've watched our expertise undermined in the press and by the public. I mean, for a profession that few people knew about before this pandemic, everyone seems to be an expert in it. I think it was a good economic model for Google to start giving out MPHs after 2 or 3, Facebook posts. But, we're still here. And the first thing that I know, and this is just de Beaumont very quickly, but this is what I know. I know that everybody in this room has contributed to saving lives. And the unfortunate part is we know this truth, but there's probably going to be no movies or television series made about us and the work that we've done. Now I'm 47, so I've grown up watching all of these. Have you all watched these shows? It's not much public health, but there's a lot about physicians. There's a lot about healthcare providers. We need to persevere despite this. And I really wish that I could have said to y'all today, congratulations, right? Tell you that it's time to rest, that we could have had a headline like this, right? Pandemic is over. Grateful Nation celebrates public health. Electeds investing cash. But everybody knows we're not there yet. We're looking at increasing cases. We're looking at a surge. And we know the work's not done. I would love, you know, a number of people, Robin, who have said we need to make a public health version of Parks and Rec. I've asked my wife so many times, you know, we all watch these shows with like Food Network where you never get to eat the food. It's the most ridiculous thing. But people watch these shows of food that no one gets to ever eat. And I always say to my wife, like, why isn't there like, you know, top epidemiologist or, you know, next health educator? And she just looks at me and says, well, I think you know why. But this is how we have to engage. And I love that energy, right? And the hard part is, you know, we're tired, right? I think we're hurt. I think for many people, we're broken to a bit. You know, we watch people get celebrated and other professions lifted up for what they've been doing throughout the whole pandemic, right? And we don't begrudge this, but we sit there and we wait for just the simplest recognition that we have done this while we are tremendously understaffed and that we are tremendously underfunded. And that recognition has really not come. But this is why passion is important. I don't think you can do public health right now if you're not extraordinarily passionate about it. The field is just asking too much of us. Who would do this work? And all of us, right, have friends who have left the field, who have tapped out. And we have to ask ourselves, why do we stay? And we stay because of the passion. You know, we do something called the Public Health Workforce Interest and Needs Survey. It is the only national survey of the governmental public health workforce. And one of the questions we put on it in 2014 was, why did you get into public health? And I wanted to track that data point over time. But the research team said, you can't put that question on anymore. I said, why? It's an important question. They said, well, because 96% of people say they got into public health for the mission to change the world. The other 4% we don't really need to track. And so as we continue in public health, as we continue to do this work that is so critical, but often overlooked, we are, public health to me is the foundation of your house. It's probably not the thing you talk about a whole lot. It's not the thing you think to invest in, but when it's cracked, everything else is in jeopardy. And right now, our foundation is cracked. And we have to mobilize our passion to continue to do the good work that we need to ensure the continued safety, security, and economic prosperity of our nation. We are one of the groups that continues to strive for health equity and health justice in the face of systems that would otherwise not pursue those goals. So passion, though, and I think this is the important point, passion cannot obfuscate the need for change. And so really that's part of my message to you all today is to take that passion and focus it for making public health better. we are all too often right now looking at more money from the federal government and some interest from other sectors. But that money is all too often being used to perpetuate a system that we know is broken, to get us forward to modernize public health. We have to be ready to change. And our passion right now needs to be not maintaining what is, but building what is needed. And so the most challenging thing I'm going to ask you to do today is to not take a time out, but to double down, to lean in, to begin to build the future of public health that you want and that I want. And we're going to do that in a couple ways, right? And there are a couple things we have to do together. We have to champion the need for better data. As health educators, as epidemiologists, as anyone in public health knows, we have to have statewide and nationwide data to inform our practice. And that honestly, and I'm happy for anyone who wants to disagree with this, we can't accept that grocery stores have better access to data than public health practitioners do. Grocery stores nationally, you have a national chain of grocery stores, they have amazing data systems. We continue to talk about modernizing our data systems. What does that really mean? Do you just want to modernize your data system in Camden County? Do you want to do it for the state of New Jersey, but not Pennsylvania? And I agree, and I see, so I'm watching the chat. And Christy here has, this was the whole conversation this morning, Christy, in my house. We are underpaid. We are undervalued. These things won't change in the short term. But that doesn't mean that those of us who have committed to do this work should not be just as passionate about it as we were before. Underpayment and undervaluation, I have been in public health for the better part of 25-ish years. And that's never changed. The challenges of working in government have never changed. But that's part of our challenge, is to persevere through this time, knowing that there are challenges. Amanda talked about interoperability amongst data. Absolutely. This is the problem. And I want you guys to agree to do one thing today. Never say the public health system. Don't ever say that again, because it doesn't exist. At a minimum, we have 57 public health systems in each of the states and the territories. And then further, in many states that are decentralized, we have additional public health systems. We need to bring unity to the chaos. That's part of what we have to be passionate about. And yes, there's going to be a time when medicine advocates for public health. Let me tell you the most underrepresented or undercovered story that there has been. The American Medical Association recently came out and said, we need to support public health. They made an actual policy statement about public health. And nobody really covered it. It was pretty important. So another point for us. We need to tell everyone why public health matters. We need to build on the hard lessons of COVID. We need to tell this public health story. Let me tell you a story that I often tell folks. I find it fascinating that we can build a robot. We can put it on a rocket ship. We can send it to Mars, where it got out and became a little robot tourist, and it took photos and it sent photos back to us. But what we know is that there are children who have asthma who are hitting the ER regularly, and we have very few ways to find them. They are seen by different pediatricians, visiting different hospitals, have different insurers, all different siloed systems that don't work together. And where it's very hard for us to find out that those kids all live in the same apartment building. We could reduce healthcare costs, improve their health, improve their education, take the burden off of mom and dad who are taking time off from work to go ahead and take their kids to the pediatrician after going to the ER. But we have to tell that story. We have to remind people that we can't do that. That while robots are taking photos on Mars, our kids are not as healthy as they want to be. And yes, change is extraordinarily hard. And that change, any of the change that we want, can't come from within. That's why we need partnerships. We need other sectors. We need to make calls. We need to educate the media. We need to sit with not knowing our top 3 causes of mortality and morbidity, but knowing our top 3 employers, right? And making it more about us as a community and let us engage these new partners. Now, every bit of the chat is telling me what we all know, that this is hard right now. And it's getting harder as people are harassing and bullying or undermining our credibility. But that is honestly where our passion for this work must protect us, must insulate us, so that we can continue to do the necessary work. We have to focus on our impact, focus on our wins. We are often much too humble, and we don't tell people what public health has achieved. And that's important. It's important to know, if you've never read the article on the 10 great public health achievements, it's a worthwhile read. 30 years of life expectancy increase between 1900 and 1999, 20 of those years attributed to public health. And public health may not be glamorous, and it may not be a flashy headline, but I think there is a flashy headline. I think there are ways that we can talk about public health that helps all of us. We need to get the right messaging. Messaging, super critical throughout the pandemic. A lot of folks did messaging among communities of color. We at Beaumont pivoted and did messaging among conservative voters throughout the US. Everyone needs messaging to help them understand how to get through this pandemic. You ever wonder why Coke markets, like, who doesn't know Coke exists? Yet they still spend like $4 billion every year on advertising. Why do they have to spend so much? Because they know it works. We don't have those resources. We're going to have to find it. I found far too many people as the pandemic moved through saying, oh, when there was a big dip, I don't have to do the Facebook Lives anymore. I don't have to do the Instagram Lives anymore. We have to do those things. The only antidote to misinformation is credibility and trust. In your communities, you must be those who have that credibility and trust. And not to get too corny, but all of us at some point have probably read the Lorax. And there's this quote from the Lorax, which I always like. There's a problem with the Lorax, though. The Lorax is a children's book. And so unless someone like you cares a whole awful lot, nothing's going to get better. It's not. Okay, Lorax, I care. Is it better? Do the trees come back? No, it's really hard. And that's what the Lorax doesn't tell you, right? The Lorax doesn't tell you this is going to be hard work. The Lorax it's right. Caring is necessary. It's not sufficient. We need resources. We need to mobilize ourselves and a broader army to really begin to talk about public health. How interesting it was so quickly mobilized against public health messaging and protocols. How quickly people who weren't wearing masks were something of interest and freedom, and bringing those ideas, mobilizing on Facebook, having little marches. yet there have been no marches for public health. There probably needs to be. There weren't people making videos about how easy mask wearing was, about why not just do it. We have allowed a very small but very vocal minority to change how we are engaging with the public. And that can't be. We need to start calling out the realities that, and we're actually studying this right now, of all the health officials, of the 200 health officials that were terminated, resigned, forced to resign, et cetera, throughout the pandemic. What was the political structure where they were terminated? What was the party orientation? And how do we move forward? Because I fear that we have long thought that public health is one side of the aisle or on the other, when we should be telling people it's the dirt on which the damn aisles were built. I had said to someone yesterday, if I had one thing I could do, someone said to me, Brian, you go back in time, you can change one thing. It would be going back to the founding fathers and saying, hey guys, can you put public health as one of those federal powers so that we can have unity? Because could you imagine running our defense department in each state, in each county? We're finding that states and localities, when not aligned, cannot win a battle. That's what we're seeing. So, want to just say, get ready. I want you to recharge and reboot and refresh. Now, I'm not supposed to say this, and so, you all can block out the recording at some point. But one of the things that we have in the Public Health Workforce Interest and Needs Survey is a validated PTSD scale, and we have received over 36,000 responses, all from people working at state and local public health departments throughout the US. Early data, don't quote me on this because my team will kill me. Early data show about a quarter of the public health workforce have symptoms of PTSD. And we're gonna have to figure out how to get us better and how to get us recharged and how to get us refreshed. Because this fight has just begun, right? This fight has just begun. It will not end with COVID. We are entering a time that is challenging, and the only thing that's going to insulate us and get us up every day is each other, talking to each other, and wrapping ourselves in our firm belief that public health is important and needs to be championed. And I have said at times, I have a friend who does good work, and he makes boxes. And he makes really good boxes. And he gets up, he does his work 9 to 5, comes home, spends time with his kids. Doesn't really think a lot about boxes when he's at home. I think about public health all the time. I see it everywhere, right? I've corrected my poor children who can say like, hey, that's a public health problem. Like, right, that's a public health problem. That's the kind of energy that we need, and it's just really hard to maintain because public health and working in this field is not building boxes. It's not something that we do for a paycheck. It is something that we've done as a calling. And so I'm going to give you this today. This is my public health serenity prayer, and I've been thinking a lot about this. Listen, gang, I get it, right? I do this work too. I'm totally with y'all. I'm tired. For me, as someone leading a foundation, no one has ever prepared us to lead throughout a pandemic. No one has taught us how to lead through a racial uprising. And certainly no one has taught us to lead when those two things are happening simultaneously. So I try to think about this, and this is something I've been playing with. It's this idea of just, you grant me the serenity to accept those things that cannot change. So many of us are fighting with people who aren't ready for change. They aren't ready to hear the message. They aren't ready to adopt the public health measures. And we need to be able to step away from them. Let them know that we're there. We're there to answer their questions. We're there to work with them, and that we're open to engage when they're ready to change. We have to be granted the courage to continue despite the challenges, to change the things that we know are not right or not just. We know that. Because honestly, we need to be granted the wisdom to change the world. Because unless we do it, who's going to do it? I'll give you, thank you, Suzanne added political unrest. Thank you. Thank you for that one as well. Being in DC, that one was front and center. All of this stuff is real. We did have a coup. We did have a racial uprising. That police officer murdered George Floyd. And we let this pandemic get out of control because of bad leadership from our former president. And I'm willing to take any on that question. Anyone disagree with that? Bring it. Media has said to me when I've done media, you've said that the former president did a bad job containing the pandemic. Do you feel that's political? I said, that's not political. That's factual. We are underpaid. It is hard to do our job. I believe it was the health commissioner in St. Louis County put a mask mandate. This was in Missouri, put a mask mandate in. As he left the city council chambers, people yelled racial slurs at him. And he turned around, and I mean, many of you are from New Jersey, so you know the salute he probably gave them, right? He flipped them off. I lived in New Jersey for a lot of years, so trust me, I know you all know that. And you know what the outcome of that was? He had to apologize. Our job is hard. But that's why public health right now is for the passionate, and you do have to figure out how to recharge. You got to find people to talk to. You got to talk to your peers. And we do. We need to issue broad calls for action, but we need to follow them up. We need to be there every day, talking to your butcher, talking to everybody, your friends, your family. Let everyone know what public health is. I want you all to read. This is your homework assignment. You all have to read Paul Starr's Social Transformation of American Medicine. And you will realize that before 1910, physicians were thought of like barbers, trained in similar ways. There was no medical licensure before the 20th century. They thoughtfully changed that, and that is the kind of action that we need. We need to be going to our city council. We need to be going to our state legislature. We need to be going to places to just tell everybody, there's nothing that you do without health. You want kids to read on grade level, they need to be healthy. You want them to actually graduate and not drop out, they need to be healthy. You want to go to worship and worship fully, you need to be healthy. You want people to show up and have full engagement in work, they have to be healthy. But we have to start to build this coalition, and we need the passion to keep it going. And so my message is, again, you guys are amazing. And we're in a real fight. And when I think of the fight, I want to fight with superheroes. And I think every person on this call today who took time out to try to get recharged, even in this conversation, you're all superheroes. And I am just so pleased and happy to be fighting this fight with you guys. So this isn't a first date and then it's over. Follow me on Twitter, email me on LinkedIn. Let's all keep a conversation going, because we're all part of the same army that right now is broken and disjointed, and we need to find more unity and more commonality amongst all of us so that we can do what we want to do, which is change the world for the better. Because if we don't do it, who is going to? Thank you for everything you've done in this pandemic and before, and for everything that you're going to do after. Take some time around the holidays, recharge, but come back strong, because we got to keep going. And I'm happy to answer questions, and I'm just privileged to have been here and had this time with you today.
Thank you so much, Brian. That was such a pep talk. I think one we all needed. So many comments about the graphic you used. I think that was a fantastic graphic that you shared at the very end. So thank you for sharing that as well. Caitlin's asking for the graphic to please send.
Yeah, I will send the whole deck to you, Hillary, and you can just pull out the graphic. I mean, any graphic that we use, this is actually, if there's another graphic, we'll send you a whole bunch of graphics because throughout our presentations, we've built a couple. I want to show you one that I think is super, super important. Now you're seeing my lack of organizational skills because I can't always find my graphics when I want to find my graphics. This is when my comms person would start to mock me openly. But we've used, I'm going to find this, it's worth it. Here we go. Cartoons, That's the old one. That's the new one. So we use these, and I'm happy to send these so that other people can use them. Let me just bring up, the technology, everyone. Let's see. Share the screen. Here we go. Share. So we have used this often to talk about and frame a conversation around COVID and why COVID has not worked well in the US. And I think this is partly our challenge in public health. There's my other graphic, which I'll talk about in a second. There's a challenge in public health that we don't frame things so that people can actually hear them. I think this graphic helps a lot. And interestingly, there was an earlier version of this that we changed at the behest of audiences because everything used to be the same kind of stick. And folks said, no, it's racism needs to be a bigger stick and hunger. But this is the problem. COVID has hurt America so much because we provided plenty of kindling for this virus. And then this is my other favorite graphic, where what we know is our general response to public health challenges is to tell physicians and healthcare to get more buckets. That's how we're going to bail out the ship. But we got to fix the hole in the boat. So I am totally happy to send all of those along to anybody who wants to use them. Because again, I think when you see that photo or you see the cartoon, it really helps get through a lot of language that you'd otherwise have to try to do.
Yeah, that would be great if you can share. Those are wonderful graphics. There was one question I saw come through from Suzanne. She asked, is Beaumont taking the data from the survey to work on developing ways to address public health workforce burnout?
So what we do with these data are collected at the state and local level. And when we have enough sample size, we give those data back to the states and the local health departments and give them ideas about how are we going to do this, right? How do we address burnout? This is the problem, guys. And you know, I tell friends all the time, they say, what would make your job better? And I said, the thing that would make my job better is if I could go back and take the blue pill instead of the red pill and just believe that public health is fine and all this money from Joe Biden is great. Like, I meet with public health Tigger every day. He was like, don't you love the money? The money is great. And I'm like, public health Eeyore. I'm like, the money's not going to help. We're going to be in the same situation we are at the end of every pandemic because you all believe that there is some entity that rules public health, and it doesn't exist. And so the hard part about dealing with burnout is you have to deal with that burnout in 57 different systems, or in, you know, like take North Carolina, where I did all of my training. We have 84 health departments in North Carolina, you know, versus like a Florida where it's one centralized health system with many health departments, but they all roll up to one place. So this is the conversation we're having. How do we build the workforce? How do we deal with burnout? How do we have Again, just think about it. Just do it with me for a quick second. How would we have fought World War II if each individual state had its own choice? Nebraska would have planes from 1910. They'd say it still works for us, right? Maine would probably not get involved at all, right? You can't do that way, but that's how they're asking us to fight public health. You know, and yes, some places I am honestly, Tiffany said in Virginia, the local health departments were sub-departments of the state. I am starting to more believe in a model of state control. And this is me as someone who worked in local health departments. We got to figure out, one of the things we want to look at is those long-serving health commissioners at the local level. What was the political structure that worked for them? Because here's the thing. Donald Trump interfered with CDC. We know that. It's been reported in the newspaper. Is that unethical? We'll all probably agree it is. Is it immoral? We all probably agree it is. Is it illegal? No, it's not illegal. We've all worked for health commissioners who've done things, or mayors or county commissions, and thought, well, that's not the right public health thing to do. But how many of us have heard the saying, you know, I serve at the pleasure of? And so this is our challenge, right? Our challenge is this pandemic brought into very crisp, detail the challenges we have. Contact tracing, we can hire all the contact tracers we want, gang. It doesn't work for a viral, for a respiratory disease. It works for STDs because mostly we know who our STD partners are. And I've never gotten an STD while watching Shang-Chi at the local movie theater, but I sure as hell could have gotten COVID. And we can't contact trace that. And so we need to stand up and start, we need to start calling bull when bull is there. And if we don't, again, stand up, it's not quite sure who will.
Yeah, really great point. Thank you so much, Brian. I think this was fantastic. I think I echo everyone's sentiments that this was truly needed. And again, a great pep talk. And we'll be sure to follow you on social media, and we'll be in touch.
I'll follow you back. We're all family, guys, so stay strong.
Great. Thank you so much. All right, next on our agenda, I'm going to share my screen, and we're going to go into an awards and scholarship presentation from Krista Riel. She is the Awards and Scholarships Committee Chair from NJSOPHE. So Krista, I will hand it over to you.
Great, thank you so much, Hillary. So welcome to the Awards and Scholarships presentation. As Hillary mentioned, my name is Krista Riel. I am the Awards and Scholarships Chair of NJSOPHE. Each year we offer several awards and scholarships to encourage continuing education, recognize accomplishments, and call attention to those who have significantly contributed to NJSOPHE as an organization. The Awards and Scholarships Committee would like to thank the applicants for taking their time to apply, and encourage everyone to keep an eye out for the 2022 applications, which will be released on our website in September. Although you do not need to wait until September, you can go check out the website, see previous winners, and see the information. You can all do that right now, so I encourage you to do that. If you have any questions or concerns regarding our awards and scholarships, please feel free to reach out to me. And now on to the winners. The Anna Skiff Memorial Scholarship covers the registration cost of the CHES or MCHES examination. It is awarded to someone whose scholarship, commitment, and demonstrated potential embodies the skills and competencies of the health education profession. This scholarship is awarded to a member who is a student or recent graduate and is eligible to sit for the CHES or MCHES exam within a year of the award presentation. The Anna Skiff Memorial Scholarship Award represents NJSOPHE's commitment to excellence in health education through academic preparation and credentialing. So this winner has obtained a Master of Public Health degree from Rutgers University in 2020 and has recently completed the Community Health Leadership Program from the Satcher Health Leadership Institute. She has a passion for health education and promotion, and is a pioneer in public health education, leadership, and management. The 2021 winner of the Anna Skiff Memorial Scholarship Award is Shreya Tripathi. Moving on to the Karen Denard Goldman Academic Scholarship. This was created to recognize exemplary student achievement. It is awarded to a student or a recent graduate who demonstrates excellence in academics, as well as a commitment to the field of health education. The winner receives $500, as well as a certificate of achievement. This individual is committed to equity and aims to transform the conditions that create health disparities. She recently enrolled in Rutgers University's Master in Public Health degree with a concentration in LGBT health and has a diligent, passionate, and detail-oriented approach to her work. Her ultimate goal is to pursue a career in public office where she is able to create policies and advance the way we think about health and well-being. The 2021 Karen Denard Goldman Academic Scholarship is awarded to Maria Rosas Barrejas. On to the Louise Chutt Award for Program Excellence. So this award recognizes outstanding contributions made by a health education project or program. Project staff must address key issues in public health, demonstrate commitment to excellence in the practice of health education, establish collaborative efforts, and the program needs to show the potential for replication by other agencies. This program was geared toward vulnerable populations. By conducting a needs assessment, the creators of this program realized there was limited access to violence prevention, educational materials, programming, and education regarding domestic violence and sexual assault, safety planning, and legal advocacy available in American Sign Language. Through collaboration with the Deaf Advocacy Project, critical materials to translate were identified, and videos with violence prevention information were translated into American Sign Language and posted online and social media. As a direct result of this project, the team plans to hire a deaf advocate to provide advocacy in ASL. The 2021 Louise Chutt Award for Program Excellence goes to Vulnerable Populations Advocacy and Deaf Services Program, and it's being awarded to Courtney Riseborough and Helene Zingraf from the Domestic Abuse and Sexual Assault Crisis Center of Warren County. So the Outstanding Health Materials Award is a chance for NJSOPHE members to be recognized for excellence in the creation of health education pieces, including print, multimedia, and training materials. Starting in April of this year, this team targeted healthcare workers by creating flyers, social media posts, and PowerPoint presentations based on infection prevention and control guidelines. Materials were based on the health belief model and a learning needs assessment specific to healthcare workers. As of September 2021, their infection prevention social media materials have reached over 150,000 people. Please join me in congratulating the winners of the 2021 Outstanding Health Materials Award to Jasmine Davis, Miriam Gonzalez, and Kelly McLaughlin from the New Jersey Department of Health for Project First Line trainings and promotional materials. And lastly, for my presentation, I have the NJSOPHE Trophy, which is awarded to a member who has gone above and beyond the call of duty for NJSOPHE and who has dedicated countless hours to the betterment of the organization. And this person also exemplifies commitment and loyalty to this profession. This individual embodies every element of the NJSOPHE Trophy and a health educator. Passionate, talented, dedicated, and incredibly generous with their time. During a year when programs were entirely virtual and a major area of focus was to sustain member engagement, this individual was not only an active part of the program committee, but also helped shape the content and format of our mid-year and annual programs. Always willing to jump in and provide support whenever necessary, this person was an invaluable asset to the committee. Most notably, this individual organized the mental health first aid training for NJSOPHE members during the mid-year program, and it was well attended and well received by our members. We owe a huge amount of thanks for your hard work this year and look forward to future contributions to NJSOPHE. It is my pleasure to award the 2021 NJSOPHE Trophy to Paul Bellin Boyer. And with that, I will turn it over to Tara Rice to present the President's Award.
Hi, can you hear me?
I can hear you.
Okay, sorry, I can't see myself. Hi, everyone, I'm Tara Rice. I'm president-elect of NJSOPHE. I'm filling in for Devangi Patel, who's the current president, who couldn't make it today. And the bullets are just flying at me. So I'm here to present the President's Award. And this is given by the outgoing NJSOPHE president, so this is coming from Devangi, to a person who has made extraordinary contributions to the practice of health education and demonstrated praiseworthy achievement in their work through their commitment to NJSOPHE. It's NJSOPHE's highest honor. So this year's winner of the President's Award goes to an individual who went out of their way to support NJSOPHE through engagement and commitment to health education. Again, during a year where all of our events were virtual, this person demonstrated a passion for advancing health equity, contributed to NJSOPHE advocacy position briefs, and regularly shares interesting articles for members. This person has been a health educator for over 20 years and is committed to advocating for patients through work with patient education agencies and advocacy organization. This individual's passion and commitment to NJSOPHE is clear and represents the best qualities of our membership. This year's President Award goes to Julia Ulf.
Okay, thank you so much, Tara. Thank you, Krista. And I just want to say congratulations to all of our award winners. It's so different virtually receiving an award. There's no clapping. So let's all clap together, maybe silently, for our award winners. Congratulations. So we are right on track for our next session, which I hope you enjoy as much as we enjoyed pulling this together. So this is actually going to be a little different. We're calling it a lightning round, and we're going to showcase really 5 projects in the next 35 minutes or so. You're going to hear from your fellow NJSOPHE members throughout this lightning round. So each group, each presenter has 7 minutes total, and I'm going to hold you guys to it. I'm going to start a timer and you'll hear the buzzer go off. So please, as each of our presenters start your own timer as well, so we stay on track. But I know we all practice this, so we should be good on timing. So the 7-minute time block for each of our presenters also includes a Q&A. So we'll try to keep the presentations around 5 minutes so that everyone can ask their questions in the chat box. So without further ado, I'm going to kick it off to our first presenter, who is Linda Brown. And Linda, I am going to start the timer right now, so you're good to go.
Thank you, Hillary. No pressure on the time. I'm feeling it already. Thank you so much for having me. I'm Linda Brown. I'm the current executive director for a nonprofit called Neighborhood Connections to Health in Freehold Borough. I'm going to talk to you a little bit about the organization today. The background of our organization started in about 2016, and kind of using a really kind of tried and true needs assessment process. We started by getting to know the community. And Hillary, you can go to the next slide, please. During the first year that we existed, there was a lot of work to understand what the community needed. And the end result of that was the 4 priority areas, or what we call our 4 pillars, which are on the left side of the screen. And for the sake of today, I'm going to spend just a little bit of time talking about kind of our pivot with COVID related to our Access to Healthy Food Committee. Some of the early work with this committee really related to trying to get partners that were serving the community, trying to address food insecurity, and bringing their efforts more collaboratively together. And one specific program, which you can see also on the slide here, is our bi-monthly mobile pantry, which really at its start was trying to bring in healthy, fresh produce to our community. This particular program still exists, and it started back in the middle of 2019, and it partners with the Fulfill of Monmouth and Ocean County, and also showed that there was a gap in what they knew about our community. So it was a really great success in that. If you could go to the next slide, Hillary, please. As you can imagine, things changed for all of us when COVID hit. And in March of 2020, there were some really dire discussions around food security in Freehold Borough. One of the things that we know about our community is about 80% of our school age population is on free or reduced lunch. And our community started to band together in ways that we had never seen before to meet the need of the sense that spring break meant there was no food from the schools. So with partnership from about 15 different organizations, we were able to raise almost $30,000 in the matter of just 3 days to be able to supply almost 3,500 meals to the families and community members during spring break in April of 2020. This work, which we now call the Food Safety Net in Freehold, continued on to homebound meal deliveries for several months to our homebound, isolated, those that were sick, because we were trying to meet the needs of the food security of within the community. You can go to the next slide, please, Hillary. This is really what I'm here to talk about. This is the passion that Brian talked about. Our group with, we address food security. We have partners in our community that we work more closely with since the start of the pandemic than ever before. But the reality is there was food, but there wasn't always healthy food. And we know healthy food matters. It matters in everything. It matters today, it matters tomorrow, it matters 10 years from now. And while our organization was founded on a very formal needs assessment, we were able to kind of mobilize our very changing community needs. And thanks to our funder being flexible with some of the dollars we had, we were able to put together this concept of a pop-up produce market, which you can see here. And the reason I highlighted this is when you talk about passion and things that matter to our community, respecting choice and respecting individuals that may be in need, or perhaps those that are not in need, was so core to, or so important to the core of this program. In the hottest days that I can ever remember being outside and masked, we had upwards of 30 volunteers helping us. And at the height of this program, we were helping 250 people each week. Imagine on a Friday in July, 95 degrees and 100% humidity, we kept getting more volunteers. And the most important part about this program that I wanted to highlight was that our individuals waiting in line 1 week were coming and volunteering with us behind the table the next week. And it really shows the level of respect and the level of trust that we were able to connect with the community. And we're really, really proud of how this has transformed the relationship with the community, and also moving into the program on the next slide. We wanted to also continue to support the assets in our community. So this pop-up market that we had evolved into a farmers market voucher program. In this particular program, we were essentially competing with the information on the last slide. It was the same day. This was about 4 or 5 blocks from where we were distributing our produce. And with this program, we were offering either $15 or $20 vouchers per week, depending on the household size. And it empowered people to choose what their family liked. It empowered them to try something new that was seasonally and locally grown. And most important, this also helped our community. It brought more people to our farmers market, and it helped our farmers, which were also really, really struggling at this time. So I hope that my very brief overview helped to see some of the passion here, but we love this community. We love these programs, and we're really happy to serve during a really, really hard time. And we continue this work today.
Great. Thank you, Linda. You have 1 minute and 33 seconds to spare. So great job. And thank you for sharing your amazing work. Are there any questions for Linda? I don't see any in the chat box, but feel free to submit a question if you have any questions for Linda before we move on to the next lightning round. One question came through. If you could give advice on how to start a program like this on your own, what would you tell us?
I would say don't reinvent the wheel. I mean, I kind of expressed that we have partners and we were able to fill gaps with some of the dollars we had for these programs. But one of the biggest unintended benefits of this pandemic has been work for about 5 years prior to the pandemic to bring food serving partners together. And Freehold Borough is a small community. This was it. And we're not letting it go. So trying to find what already is happening and leveraging that is so important, because I think oftentimes we want to be the change and we want to be part of the solution. But if we're competing with people that are already doing the work, it's probably not going to be as successful in the long term. So finding the partners, and then, unfortunately, dollars are king here. So finding grants or other community supporters can be really important to making this happen.
Great. Thank you, Linda. And that is 7 minutes. So we're going to move on to our next lightning round. So our next lightning round presenter is Tiffany Neal. Tiffany, I am going to hand it over to you. Just tell me when to advance the slides and I'll start the timer now.
Okay, thanks, Hillary. So during the first year of the pandemic, COVID-19 guidelines coming from the CDC and other organizations were often hard to follow. For example, strategies like social distancing, reducing contact with others, and staying home don't work for everyone. They might conflict with a person's job or family situation, especially for populations impacted by poverty and other challenges. Sometimes people felt that they needed to choose between protecting their health and meeting their other needs. So we saw a need for risk reduction messaging that really emphasizes autonomy, practicality, and choice. Next slide, please. We created Safer COVID-19 as an interactive risk reduction tool. It's available in English and Spanish, and you can access it either as a web-based tool, similar to a survey on our website, and also a downloadable and printable workbook. It was developed by public health professionals with input and testing from diverse communities. In contrast to other COVID-19 educational materials that have been distributed out there, Safer COVID-19 doesn't tell people which activities are more or less risky or safe. Instead, it helps users to assess an activity's risk for themselves and then make a plan for how they can stay safer during that activity. I'm going to give you a few screenshots from our web tool so you can get a sense of what Safer looks like. So first of all, a basic overview of how it works. There are a step-by-step process that you walk through in order. First, you choose an in-person activity to focus on. Then you answer questions about that activity, about different characteristics that would contribute to its risk, the impact that getting COVID-19 could have on your life, and why that activity is important to you personally. And finally, at the end of the tool, you get to make a custom plan to stay safer from COVID-19 using specific strategies that you feel will work for you. Next slide, please. So this is the first question about picking an in-person activity to focus on while you go through the tool. These are the top level categories, and when you click one of these, you actually get sub activities under each one of these. Next slide. Oh, I think you missed a couple. Yeah, there, yeah, that one's good, within 6 feet. So this is one of the risk questions. There are a variety of risk questions, but I only included a couple. Asking, will anyone be within 6 feet of you at this activity? And then on the next slide, it's asking whether the activity is indoors. And you can see there's also a little bit of an opportunity for micro health education. In the smaller gray text, it explains why this question matters, why it's relevant to the risk level of the activity. After you go through the risk section, you go through a section that asks about how COVID-19 could impact your life. For example, would you be able to get the medical care you need? Do you have close contact with people who are at high risk in your life? Would you have issues with childcare if you had to stay home from work, etc.? And finally, we ask why the activity is important to you. Maybe it's your job and you have to go to it. Maybe it's something that's important for your mental health, like spending time with friends. And at the end of the tool, people get to think about the risks and impact of COVID-19 and weigh that against the importance of the activity to them. If they decide that they do want to carry forward with doing the in-person activity, we give them this menu of options of ways to reduce their risk during the activity. And they can look through this whole list, and some of these work for some people and don't work for others. Some work for some activities and not for others. And so this gives people the opportunity to develop a tailored plan for themselves. Next slide, please. So Safer COVID-19 helps people feel more in control of their health and their life. It gives them choices so they can make a practical plan to stay safer during the pandemic. And ultimately, it helps people feel confident about staying safer from COVID-19 in a way that really works for them. I encourage you to check out our website, safercovid19.org, where you can access the web tool. And we also have a partner toolkit on there to help promote and distribute it to various communities that you can check out. Safer COVID-19 was created by a new nonprofit organization called Public Health Connected. I mentioned it a little bit earlier in the chat. Our mission is strengthening the community of public health professionals to meet the current challenges of working in public health. So I encourage everybody to check out that website as well. Among other resources, we do have a cool shop with public health swag, such as this great t-shirt and about 50 other t-shirt designs that you should check out while you're on there. Thank you for your time.
Thank you, Tiffany. So we have about a minute and 30 seconds in our time block. Are there any questions for Tiffany? Other than a lot of great feedback.
I see there was a question, how did you go about testing materials in diverse communities? We worked with a lot of partners who work with different priority populations that we were focused on, and we asked those partners to take our early drafts to their community members and have people look through kind of our early ideas, give feedback, and then as we developed the tool more substantially, asking them to try it out, try walking through the steps, what works for you, what doesn't work for you, how would you make this better? So those were some of how we got feedback.
Tiffany, another question about the languages that Safer COVID-19 tool is available in. I believe you said Spanish and English.
Yeah, it's currently available in English and Spanish.
Any other questions for Tiffany? Okay, thank you, Tiffany. This was great. We will move on to our next lightning round presentation. These are actually the award winners that we just presented to. This is the Project First Line team. So I am going to hand it over to the team, and the 7 minutes I will start right now.
Thank you, Hillary. So good afternoon, everyone. My name is Kelly McLaughlin, and I am from the New Jersey Department of Health. I have Miriam Gonzalez on here with me. She's one of the health educators for Project First Line. I'm the team lead for Project First Line, and we also have another health educator working with us on this program. Her name is Jasmine Davis. And so I'm just going to give you kind of a brief overview of who we are and what we do, since we are a very new program to the Department of Health. So Hillary, if you would please advance to the next slide. So Project First Line, it is a CDC funded training initiative that was born out of the COVID-19 pandemic with the mission to prevent the spread of infectious diseases in healthcare settings, such as COVID-19, but other types of healthcare associated infections as well. And the vision of Project First Line is empowering frontline healthcare workers with giving them the knowledge and the skills and the confidence that they need to be able to apply these basic infection control practices and protocols in their daily work to not just only protect themselves and their patients, but the workplace that they're working in, their families, and the community at large. And really what we're hoping to accomplish with this initiative is offering multi-platform training events, which cover a variety of infection prevention and control topics, and including a diverse group of healthcare workers. We want to be able to expand our reach to include students and also non-clinical support staff, and place an added focus on long-term care and acute care facilities, given the fact that these types of facilities were the hardest hit during the pandemic, and that we also really want to engage in and support the increase of promotional activities for Project First Line. So even though education and training of frontline healthcare workers is one of our main priorities, the CDC also wants us to focus a lot on the promotion and marketing of Project First Line. And the ways that you can help support us in our work is hosting a training at your facility, or spreading the word about Project First Line. All of our social media posts can be found on the New Jersey Department of Health social media pages. So all of our stuff is posted weekly. I believe we post it about twice a week, and we can be found on Facebook, Twitter, Instagram. We even do Instagram stories, as well as LinkedIn. And another way that you can support Project First Line, as you can see on the right, is we have this flyer that is about our learning needs assessment. So we're constantly collecting responses from frontline healthcare workers and public health professionals to get a better understanding of what their needs are in terms of education and training around infection prevention and control. And to date, we've received over 1,100 responses. So you can share this flyer, scan the QR code yourself and take the survey. Any way you can help would be awesome. Next slide, please. So where are we now? So we're a new program. As I mentioned, we really just started getting trainings up and going just about 2 months ago. And so to date, we have 7 completed trainings, and we've trained roughly just under 200 healthcare workers and students studying in the healthcare and public health fields. So that's a picture of Jasmine, Miriam, and I from our first in-person training together at the NJEA Health and Safety Conference back in November. But we also couldn't do this work without the help of our 4 grantees. So I should shout out that our grantees are the New Jersey Hospital Association, the Healthcare Association of New Jersey, the New Jersey Association for County and City Health Officials, and Rutgers Project ECHO. And all 5 groups combined, we've trained over 1,100 healthcare workers so far over the last 2 months. And in terms of social media, we actually have done more social media than that. I made these slides last week. We've done 151 unique social media posts since May, reaching approximately 37,000 people per month, which is really exciting. Next slide, please. So where are we going? So fortunately, Project First Line has been awarded additional funds through July of 2024. So we'll be around for quite some time, which is exciting. And where we're going next is really targeting community colleges and universities to provide this education that we're providing to healthcare workers now. And we also want to continue to build our partnerships with local health departments to be able to engage and train frontline healthcare workers in the work that we're doing and trying to reach healthcare facilities in their jurisdictions. And also continuing to build partnerships with local healthcare organizations as well that typically represent healthcare workers that serve underserved populations. Next slide. And for you to learn more about Project First Line, because we only had so much time, you can email us directly. This is our general email inbox that reaches the entire team. You can scan the QR code to access our website for more information and resources. And you can also join our email list. We're going to be starting a quarterly newsletter in 2022. So thank you.
Great. Thank you so much, Kelly. Right on time again. So does anyone have any questions for Kelly or the Project First Line team? I do see Miriam added some information in the chat as well, along with a link to the newsletter. And it looks like Linda also posted some additional trainings out there as well. Okay, I don't see any questions. So I think we're going to move on. We're right at 7 minutes. So we're going to move on to our fourth lightning round. This will be presented by Ellen Indo, and she's going to talk about using MCHES in her career. So Ellen, I will hand it over to you and I will start your 7 minutes now.
Okay, can you hear me okay?
Yes, I can hear you.
Okay, great. So what I'm going to focus on is one of the projects that I am working on I work closely with Johnson & Johnson's behavior science team. So we're all focused on behavior change. So I'm going to focus on the project talking about the creation of and the guidance of a preventive Ebola vaccine campaign in sub-Saharan Africa. So you can go to the next slide. So really what I'm going to talk about is there was a large scale preventive vaccine campaign done in Rwanda called Umurinzi. And in their native language, that means guardian. And that ran from December 2019 through July 2021. It was extended because of COVID. And the commitment was to vaccinate 200,000 individuals with a multi-dose vaccine for Ebola. And they chose to use a behavior change intervention process to make this happen. And so in creating this program, in the process of doing this program, they really needed to say, we need to stop for a moment. We've received recommendations from the WHO in terms of how we can present this vaccine and how we can give it out in sub-Saharan Africa, but we recognize there's a big need for behavior change programming in this, and that's where they really needed the expertise from somebody like ourselves who could really jump in and evaluate the program and make it scalable. So the behavior change is focused on more than just an individual. It's focused on the person who's getting the vaccine. It's focused on the physicians, the healthcare workers, the frontline workers, the organizations, local leaders within the communities, all the way up to the policy level. So there was a lot of individuals that really needed to be intervened on, so to speak. So what I'm really going to focus on is how we use the MCHES, or how I use my MCHES as a part of the collaborative team effort. You can go to the next slide. So I chose to highlight a few pieces, although I would love to speak about all the different areas of responsibilities of being a health educator, but I am focusing on a few pieces here. So when we talked about the areas of responsibilities for conducting evaluation and research, this was largely done by our team, and we really took the time to evaluate the large scale program, not only after the completion of the program, but also during it. And we found different opportunities for optimizing the program, making it more efficient, and also making it more successful. And this program actually succeeded in having over 95% adherence rates for full vaccination, which was really exciting. And that gave a push to really wanting to find out how we can scale this program on a larger level within other nations and other countries in sub-Saharan Africa. Also, these are resource limited settings as well. So another area of responsibility I'm going to highlight, because we worked within all of them, was serving as that resource person for the health education and promotion. It was not our responsibility to run the programs, rather more to guide and inform the design and the deployment of it. This is really the work and the art of the local stakeholders, the people on the ground in the communities who really know the cultures and the individuals they're working with. So it was a really collaborative effort, and that was majorly what we were focused on, as well as we would also look at communicating, promoting, and advocating for health education as a profession. We led workshops with local leaders, more recently with the West African Health Organization, on how we can implement programs like Umurinzi all throughout sub-Saharan Africa, and it will continue to evolve. And going into 2022, we have many workshops set up with many different nations. So we're really excited about helping them come up with, and I'm calling it their own art, because every program is going to look different, but they'll maintain similar foundations. So I'm going to go to the next slide, if you could. And I think it's fair to acknowledge that this is not just my work. This is, it takes, I shouldn't say it takes a village, it takes a globe. And all the way down from the local level, when we talk about, we had spiritual leaders who were actively involved on the ground, communicating and educating. We had regional district political leaders. We have governments who are involved, as well as different global and continental funders and supporters. So this was really a group effort in a nice way. And I think, you know, that's fair to call that out. So we'll go to the next slide. And I just want to kind of highlight again, what was your childhood dream? Those are pictures of me. I thought I would change the world, but instead I became an MCHES. So I think that's kind of why we're all here. So that is that. Thank you.
Thank you so much, Ellen, for sharing your experience and your project. Are there any questions for Ellen? Just, you know, thank yous in the chat box so far. So everyone really appreciates your presentation. So thank you again. And we are right on time. So we're going to move on to our very last lightning round of presentation sharing. And I'm going to hand it over to Heather Jordan and Michelle Kennedy, and I'll start 7 minutes now.
I'm going to start my own timer too. Hello, everyone. My name is Michelle Kennedy. Thank you for joining us today. I'm co-presenting with Heather Jordan, and our contact information is there. So we invite you to contact us with any questions or comments you might have about what we are going to share today. Thank you. So I just want to say that I have a lot of gratitude about sharing this time with you, because we know and care about how important smoking cessation is. And this might be a review for folks, but we just want to shine a light on the substantial need. And just briefly, based on 2015 survey, we're estimating that 500,000 to 250,000 people could really benefit from free cessation resources that are available in New Jersey. And that's what we're going to tackle today. Just additionally, the slide shows a community-facing flyer. It's going to be highlighted a couple times in here. So, so just, you know, repeat messaging helps, but it contains the free smoking cessation resources that are in New Jersey, and it can be found in multiple languages by visiting tobaccofreenewjersey.com. But when I'm done, actually, I was just going to say I'll post it in the chat, but Heather has already gone ahead and done that for you. So please feel free to pick that up in the chat. Next slide, please. So in New Jersey, this is just an image of the several options that are available to around the state regarding, Moms Quit Connect, Quit for Kids, the Quit Line, as well as some Rutgers-specific ones like the Tobacco Dependence Program. But for the purposes of our discussion today, we are going to focus on the top one, the Tobacco Free for Healthy New Jersey Quit Centers. And just finally about this particular slide. So our role at CTS, we provide technical assistance to all of the quit centers. And we just wanted to provide an overview on how this resource can help folks in your community. Next slide. So what the quit centers can offer, they are staffed with tobacco treatment specialists. They offer free 45 to 60-minute new patient assessments, as well as comprehensive and individualized treatment planning. They offer free individual and group counseling. There's also resources are available mostly through phone and video conferencing. Folks really are trying to get back up and running in person, but we all know that there's some challenges associated with that. And then also to nicotine replacement therapy. Anybody who's done this kind of work or is involved in this kind of work know that that can be a barrier for so many folks, but through the Quit Centers, free NRT is available. Next slide, please. So, and then just briefly, New Jersey residents are invited. So this is a picture, this is an image of the map of where the Quit Centers are physically located. But New Jersey residents are invited to call a Quit Center closest to where they live or work to discuss the resources that are available. So just don't panic if you don't see a Quit Center available in your county. They are available to anyone throughout the state. Next slide, please. So here's a snapshot of the 5 core centers where and their contact information. Again, we just want to reiterate that it's available to anyone throughout the state. But I just want to additional highlight regarding this one. So they have there's support groups available, again, individual counseling, but there are some Quit Centers that have specialized groups or priority population support groups, including LGBTQ+, as well as Spanish-speaking support groups that are available. So just because it might be available specific to one county where that Quit Center is, it's available to anyone. So again, please go visit that link that Heather so kindly put in the chat, and you can get more information about those groups as well as the languages that are available too. So I'm going to turn it over to Heather.
Next slide, please. Yes, that's it. Thank you. Thanks, Michelle. So I'm just going to take a few minutes or moments actually of your time today to talk about what Screen NJ is. For all of us out there, we are health educators. This is what we do. This is our training. I am thinking about that talk we heard at the top of this meeting about how we are an army trying to do our job and we get tired, and we understand that some things have happened because of the COVID pandemic, such as a sharp decline in cancer screening rates. So we understand that has happened. It's happened across this country. It's certainly happened here in New Jersey as well. So I want to take a few moments to talk about Screen NJ. Screen NJ is a statewide program that is administered by the Rutgers Cancer Institute of New Jersey. It is partially funded by the New Jersey Department of Health and healthcare and community partners across New Jersey. It is a collaborative project of many organizations, not just health systems, committed to reducing cancer incidence and mortality through an effective cancer prevention and screening program. Our initial focus from 2018 to 2021 was on lung and colorectal cancers, screenings and disparities in underserved populations. This past July, we did expand out to other cancers. You can see them listed there. Screen NJ is really valuable because not only do we focus on cancer screenings, but we also link cancers to tobacco use, right? So we promote the benefits of tobacco cessation through the delivery of educational sessions to healthcare professionals and the community at large. And we also do take the time to provide the New Jersey Quit Center staff with educational opportunities as well. So they are receiving the latest and greatest information from the peer-reviewed scientific journals and studies that are out there so they can deliver the best possible treatment to tobacco users in New Jersey. Those Quit Center staff also have been educated on the updated lung cancer screening eligibility criteria, and they know how to assess their clients to see if they are eligible for lung cancer screening. So it's a two-way street. We certainly at Screen NJ link community members, your constituents, with cancer screening and tobacco services through a network of what we are calling patient navigators. So stay tuned for more information about this group of individuals. They have been recently hired, and they will be out there in the communities in New Jersey, linking patients and clients with cancer screening and tobacco cessation services. They are not affiliated with particular health systems. They are standalone and will be available to folks out there who might need some assistance with that patient navigation component. Also, Screen NJ does provide grants to community partners to deliver tobacco cessation services and to increase lung cancer screening rates. So if folks out there on the line are interested in learning more about the education we can provide to healthcare professionals and the community, I invite you to drop us a line or visit the website, screennj.org. And also, if folks out there are interested in learning more about funding opportunities through Screen NJ, I also invite you to reach out to me or to Michelle, and we can connect you in with those folks over at the Screen NJ program that might be able to give you more information about funding opportunities. So with that, I'm going to close, and we can go to the next slide. We thank you for your time today. And at this point, we do welcome any questions you may have about this project. Thank you.
Great. Thank you so much, Heather and Michelle. I saw there was one question. So the question is from Anna. Is there any coordination between NRT prescribers and Quitter's healthcare team to coordinate potential drug interactions?
So I'm gonna start, but maybe Heather will have some additions to add to. So regarding the NRT, what the Quit centers have available is our patches and gum, which is available to anyone if they wanted to purchase. But the other medications there, regarding like if they're using Chantix, there has to be a prescriber involved. So there is certainly some clinical oversight. You can't get that without a prescription. Heather, do you want to jump in with anything else?
Sure, I can. And so that's all extremely important, that what Michelle said. We also want to point out that we do have folks trained up at the Quit centers who work with prescribers as well. And we also have our medical director, Dr. Michael Steinberg, available. So if there's any questions that come up at the Quit center level where a treatment specialist may have questions about prescribing, they can always reach out to Dr. Steinberg and get some information. And then, yes, there is coordination between the tobacco treatment specialist and a primary care doctor. Sometimes there's notes that get put into maybe an Epic EMR system, perhaps, if they're all working together in that system. So we make sure that we're connecting the primary care doctor with the tobacco treatment specialist regarding any drug interactions.
Great, thank you so much.
Sure.
And with that, I'm going to close our project sharing lightning round. Thank you so much to all the presenters. This was our take at a virtual poster session. So we wanted to keep the time short and really kind of have that same feeling. So hopefully you found it successful, and we will continue doing this in the future. Our goal was just to expose everybody to a lot of the great work that our members are doing to, again, continue on that theme of today, is reigniting the passion for public health. So with that said, I'm going to close out the meeting today with a brief board meeting. So I'm going to hand it over to Tara Rice.
All right. Hi, everybody. Let me just get this in presentation mode. Sorry. My Zoom settings are covering my presentation mode. Let's see. Who cares? All right, let's just go. We got 2 minutes. All right, so I'm Tara Rice, president-elect of NJSOPHE, as I said. Unfortunately, Devangi couldn't be here, so this is my first board meeting I'm running. So I consider this preparation for next year. So really, we just like to do these meetings as part of the session, just so it gives the membership a sense of what we've been doing all year at NJSOPHE, you know, a peek behind the curtain, and maybe motivate you or inspire you to get more involved. So just a couple things on this agenda. We sent out the minutes. I think Samantha sent them yesterday. So we need to approve the mid-year and the annual meeting minutes. So hopefully you had a chance to look at them, and you can use the chat, but can someone, anyone want to make a motion to approve the mid-year minutes? Linda, motion to approve both. Can we do that? All right, we're doing it. So motion to approve both. Second, all in favor, you can comment aye or yes, however fancy you are. All right, and then anyone opposed? I don't see any. All right, am I doing this okay? All right, okay, I think so. All right, so next up, so the minutes are approved. Okay, so we got that. So next we just want to highlight some of our NJSOPHE accomplishments this year. Obviously, you know, we are just finishing the annual meeting series, which was amazing, the mid-year. So thank you to all of the program planning committee. The attendance has been amazing. You can see some of the numbers here. Our last session, the Infographics 101, had 222 attendees. I think today we were close to 200, so amazing engagement from our members. Our social media presence has really been on the rise. It's been a huge focus, in this virtual environment. You can see we have 693 Facebook followers, almost 1,000 Instagram followers, so that's great. We launched our NJSOPHE book club this year. We enhanced our advocacy members to almost 30 listserv members, working on a marijuana policy info brief, and then really did some enhancements to the NJSOPHE website to make the awards and scholarship pages more visible, and a bunch of other things. These are just the major contributions that have happened this year. I know we're at 1:30, so I'll move really quickly just to highlight the membership update. So you can see with the colors across this bar chart, we had a little dip in membership, and I think we're ending the year at 163 active members, where we started at 184. So lost a few members along the year, but hopefully we can make that up next year. And lastly, I just want to introduce our board for next year. A couple of things to highlight here. I want to welcome new board members. The communications coordinator, Livia, is new to our board, so welcome. And also welcoming back Sonika to the program committee. So welcome to the new members, and thank you to everyone that is sticking around and hanging in there for 2022. We've done some amazing work during a really difficult time, so thank you for that. And I look forward to building upon this next year and continuing this work. And for anyone that wants to get more involved in NJSOPHE, you can go to our website, look at the committees, reach out to the committee chair. And if you have any questions, feel free to reach out to me. But thank you to everyone, and thank you for this wonderful program. Any final words, Hillary?
Just want to say thank you. Thanks, Tara, for closing us out with the board meeting. I want to thank everybody for attending today's session and all of our annual meeting sessions. They were a great success, like Tara said. We want to hear your feedback, so please complete the evaluation form. Give us your thoughts and ideas for 2022 programs. Let us know if you want to see us in person or virtually again. We're going to start planning that soon. And also make sure to complete the evaluation for your CHES or MCHES credits. So with that, have a wonderful rest of 2021, and we will see you soon. Thanks, everyone.